Welcome back. Today we are talking about alpha-glucosidase inhibitors. Now, glucosidase is a natural enzyme that we have in our body, and it helps to break down carbohydrates into smaller units so we can use that energy that we call glucose for cell functions. We're going to talk about why we want to stop that in the treatment of type 2 diabetes, or at least slow it down in the treatment of type 2 diabetes right after this. Welcome back. My name is Tammy and this is Nurse Minder, and on this channel we do everything nursing. So if you're new here, consider subscribing below so that you get the next video when it's released. Now, an alpha-glucosidase inhibitor does just that. It inhibits the use, our body's ability to use glycosidase. So it's a competitive inhibitor, which means it's going to go and bind at that site so that the enzyme can't do its job. So it's a competitive inhibitor of digestive enzymes, and the goal, the target, is to decrease the amount of glucose that we have in our bloodstream. Alpha-glucosidase are enzymes that are found inside the intestinal wall in a place called the brush border. So let's just first take a quick look at what that is before we can get into how it works and why we want to stop it. So if this is our intestinal wall, we've got our food that comes in, we mechanically and digestively start to break it down with our teeth and our saliva, and as we swallow it and it goes through our stomach and into the intestine, that's where sugar, glucose, is absorbed primarily. So you see that this intestinal wall is kind of irregular, and so when we take a little snapshot of it, here's my intestinal border wall there. I've got all these projections with these fingers on them, and we call those villi. And you can see that they have a blood supply. This is the red arterial blood going in, and the blue is the venous blood returning, because each of these are cells. Now, the villi are covered with cells called enterocytes, and enterocytes here, as you see them, they also have these finger-like projections on them, and we call that microvilli. The enterocytes are responsible for secreting enzymes, and these are the digestive enzymes that are going to help break down our starches and carbohydrates into sugars so that our body can use that for energy. Now, we begin the process with mechanical breakdown and chemical breakdown in our mouth with chewing, and amylase is one of our pancreatic digestive enzymes that starts that process in the mouth. Now, as food travels down further, our carbohydrates are still in long chains, and they're very complex, and they need to be broken down into mono, meaning single, saccharides. And that's where these digestive enzymes come into play. So glucoamylase helps break down starches and nutrients. Sucrase helps break down table sugar. Now, this is an important one to remember when we start talking about treatment of hypoglycemia. We're going to come back to that. Maltase is those yeast, kind of your malt shakes, your malt foods, yeast breads. And isomaltase works with those more complex ones that maltase and amylase cannot break down. And then, of course, we have other enzymes like lactase and trehalase. Now, these ones are in orange because the drug we're talking about does not impact these ones or other digestive enzymes. It specifically is targeting, and in this order of preference, glucoamylase, sucrase, maltase, and isomaltase. So this alpha-glucosidase inhibitor is selective for these particular 4 digestive enzymes. Okay, so we have this cell, and this cell is going to be producing the enzyme glucoamylase, and these enzymes are sitting out here waiting. I'll make that a little bigger. Waiting for a complex carbohydrate to come along. Now, I'm going to use an example of a disaccharide. Which means it has 2 glucose and they're bond together. When they come in contact with my glucoamylase, there's a hydrolysis process that occurs, and these 2 bonds are broken. And then what happens is it releases 2 single, so these are now mono. saccharides, and then those can be absorbed by facilitated diffusion or secondary active transport into the cell and then through into the bloodstream. So now let's look at how the alpha-glucosidase inhibitor works. Remember, it's a competitive inhibitor. So at these receptor sites where these enzymes are sitting and resting on that microvilla, the alpha-glucosidase inhibitor comes and binds here, and it prevents my disaccharide or my more complex glucose molecules from attaching, which means this is going to continue its journey out through the intestine. Now you see that there are still some open, which means we are only decreasing the amount of glucose because I can have one bind here, and that's going to break it down into monosaccharides. And then this one is blocked, competitively inhibited. Maybe this one is blocked. And so the net effect is decreased glucose availability. The alpha-glucosidase inhibitors, that's a tongue twister, their primary function is to lower the glucose that is available in the bloodstream. So that's an important distinction because it has no effect on insulin production, meaning it doesn't actually stimulate or stop insulin production. It simply limits the amount of sugar, glucose molecules in the bloodstream. That will signal the pancreas to do its job. So we have a functioning pancreas in patients who are taking this medication. So when it comes to looking at side effects, glucose is being kicked out through the intestine, and we know that glucose is an osmotic pull for water. So if we think about side effects, we're going to have increased glucose in the intestine, increased water. That's going to probably cause diarrhea. And I don't know if you've ever had a sugar binge, but it really causes a lot of bloating and an upset stomach, so we have that as well. Causes gas. Now, of course, this is an oral medication, so anything we put in the stomach can cause nausea and vomiting, so those are also side effects to watch for. But just in terms of understanding what the mechanism of the drug is, I'm getting less sugar in the body to manage my glucose levels, so I actually want that to happen. And the pancreas will work out the rest. But the key thing is it's actually keeping sugar in the intestine to be excreted. And so this is where a lot of our side effects and our signs and symptoms of overdose or toxicity come from. Now, on its own, as a monotherapy, it's often used in conjunction with diet and exercise to manage sugar levels. It is not at risk of causing hypoglycemia because our pancreas is still functioning and managing those ups and downs of the sugar. When it's used in combination therapy with a biguanide such as metformin, and we've talked about that before, sulfonylureas, we've talked about those before, there is a higher risk of hypoglycemia when used in combination therapy. So if we have a hypoglycemic patient, remember we talked about this blocking complex carbohydrates? And so sucrose is another name for our table sugar. It's a complex carbohydrate. So treating a low blood sugar with a sucrose, a table sugar mix, is actually not going to have the desired effect as quickly as we want because it's being blocked by this medication. So what we want to actually do is treat it with oral glucose, which is known as dextrose, because it is already broken down into a monosaccharide and it can simply be absorbed through the channels at the microvilli. Some of the drugs that you may hear in clinical practice are called acarbose or maglitol. I don't know if I'm saying those right. Maybe it's maglitol or acarbose. At either rate, these are the drugs that we might see. Now let's try and let us next come up with a visual so we can teach our patients how these drugs are working. Now, I think pharmacology should be fun, and I really work with visuals well, and it kind of helps me understand how things are functioning inside at the cellular level. I'm going to try and break down the alpha-glucosidase inhibitors and use an example as to how we can explain the whole process to our patients. You can see that I've drawn the intestine here. We'll consider that to be the city. The villa are the different communities and the different city blocks. So if I were to stand here and look down, I would see all of those rows and rows of houses. And then the microvilla are all of my homes on my streets. And so in order for things to come in and out of the home, there needs to be a port. And so we'll consider the door to be our enzyme sitting out here. So the enzyme is equal to the door. Now sometimes we want our family to come over, and sometimes we want our friends to come over, and sometimes we want the politicians to come over. It is election season right now, and some people want to hear from them. So we have different ways of inviting people in. So these enzymes we'll consider to be the door opening so that people can get in to the house, do their business, a visit, maybe they're selling you insurance, whatever that might be, and then exit again. Okay, so they don't stay in the house, just like we don't stay in our houses. And then they move on their path. Now the drug, if we think of acarbose or acarbose, I break this down into acarbose glucose. So I'm going to draw a car here now. I'm not very good at drawing cars. But this car is now blocking the path to get into that house. So these people are going to have to go right past to the next house in order to get in. So a car blocks glucose, acarbose. When it comes to migdal, I actually switch up the syllables and I call it Little Mig. And this is the house where Little Mig lives, so migdal. And that's just one way in which I try to put all of those elements into a storyline that can help people understand. So Little Mig doesn't like company, and it's the equivalent of having a no solicitor sign on the doorway. So this person, not going there either. So that's kind of a way to explain to your patients how the alpha-glucosidase inhibitors work to competitively block off these doors so that glucose cannot be allowed in. So be sure to comment, like, subscribe to this video, and if you have another way that helps you remember how alpha-glucosidase inhibitors works, please share your story in the comment section below, because together we're stronger. Until next time, make it a great day.